Today is the 4th of April 2025, and we do have a live transmission. And we will start with our wonderful cases for the last week. We did have a lot of interaction from my friends. And let's start with the Saturday case, which did have an amazing finding, which is the arachnoid cyst versus polycephalic cyst. We did have friends saying trisencephaly, but I'm insisting that it's an arachnoid cyst because it's non-communicating with the ventricular system. Here our friend Tatiana is saying that it's an arachnoid cyst will define the clear non-vascular midline structure non-communicating with the ventricular system, which is the touch point for this case, which is a case of an arachnoid cyst. You should see the comments of our friend Dr. Tatiana. And here we do have an answer from Dr. Paul, an intrahemispheric variant of holoprosencephaly, but I'm saying that it's an arachnoid cyst. Polycephalic cyst is arachnoid, it's non-communicating, yes, and here arachnoid, yes, arachnoid, yes. Here you are saying a middle hemispheric variant of holoprosencephaly. No, my friends, I am not saying this at all, because if you are seeing there is outside a ventricular system, there is an midline phalanx that is present, but interlacing with them, there is an arachnoid cyst that is present, which is non communicating with the ventricular system. I do know that this is a difficult case to give, but go with the simplest example, which is an arachnoid cyst, my friends, as we are saying. So, arachnoid cyst, and I will take the answer from Dr. Tatiana, like you see here, and we will put it in. We will put it here in the description of the case. I will actually edit. We will edit here. We will go to our creator studio, and we will edit here because it was a confusing case for many of my friends. We did say arachnoid cyst. Yes. Well defined, clear, non-vascular midline structure at the base, non-communicating with the ventricular system. Avascular, we can say avascular. We are trying to search for the least amount of words, because it's midline cystic structure at base of the brain, yes, non-communicating with ventricular system. You don't have to say well defined, yes. Arachnoid cyst, clear, avascular midline cystic structure at the base of the brain, non-communicating. Like I say, an arachnoid cyst with ventricular system. Yes, so I did put here the word arachnoid cyst because it's very important. This is the touch point for knowing the diagnosis of this case. Okay, I did respond actually to all comments from my friend, and here we go to the another case which is very important, because my friends, here this is the left side of the heart, and here by we can see an like the hypoplastic right ventricle. So it's an hypoplastic right heart syndrome. It's always confusing right or left, but you will always know that the left atrium is towards the spine. And hereby we do see a lovely answer from Dr. Tatiana, tricuspid atresia with VSD with also pulmonary atresia. So I need you to think about the case like a sequence. You don't see the right side of the heart clearly, so mostly there will be tricuspid atresia, there will be pulmonary atresia also, and we will see at the level of the three vessels the aorta. She's saying it's difficult to use outflow tracts because it's a high BMI case, but we can go with tricuspid atresia, VSD, severe pulmonary stenosis atresia. The aorta is noticed. I couldn't rule out the TGA, but we will do have a case after. Sometimes we will see hypoplastic right heart due to tricuspid atresia and pulmonary atresia, and this was the final diagnosis. So first you need to see which side of the heart is apparent. If the left side of the heart is apparent, so the right side is hypoplastic here. Why it's hypoplastic? Mostly due to tricuspid atresia. Will you see the pulmonary in this case? Also the pulmonary will be hypoplastic or atretic. So the left side of the heart with the aorta is dominant in this case. We cannot rule out the TGA, but we will have another case in a while where we will see the TGA apparent in another case. So we will change the description for our lovely case here. Yes. Hypoplastic right and tricuspid atresia and pulmonary atresia, my friend. And pulmonary atresia. Thank you for commenting. Thank you for commenting. And pulmonary atresia. Hypoplastic right heart due to tricuspid atresia and pulmonary atresia, and hereby we will go back to our lovely cases and go to our third case for this week. And our third case for this week was very confusing for many of my friends. Yes, we do have a posterior urethral valve obstruction, and if you do have a posterior urethral valve obstruction, you are considering to have both kidneys showing mild back pressure, especially in this early stage. The both kidneys are apparent. One of them is compressed by something and the other is showing high echogenicity with mild back pressure. This is the pelvis of the other kidney. So we will have here what's called the large urinoma compressing the other kidney. We do have two kidneys. One of them is showing mild or minimal back pressure. The other kidney also is showing minimal back pressure, but compressed by a large cystic structure, which is a large urinoma surrounding. So I did say for my friends that this is a urinoma. Yes. And I did have many comments here, which is lovely comments, all of them. But slowly we did reach with my friends that it's a posterior urethral valve obstruction with unilateral urinoma. Posterior urethral valve obstruction with urinoma. So I will take here posterior urethral valve obstruction with megacystis. Yes, it was a good answer. It's a good answer. It's a good answer here. Let's go back here and put this answer here. Yes. Posterior valve obstruction with megacystis and unilateral large urinoma and unilateral. Yes, unilateral large urinoma compressing the kidney with unilateral large urinoma compressing the kidney. I hope you did enjoy this case. I guess it was one of the difficult cases for this week. Okay, let's go back to our lovely cases. We did land another one. Here, another case. Oh yes, it was a difficult case. We did have an overriding aorta and all of my friends, and this is a difficult one. What do you think about the 4-chamber view, and what do you think about the 3-vessel view? you cannot ignore that there is an overriding aorta. Yes, with VSD. So my friend Rawan here is saying no pulmonary stenosis. It's either tetralogy of fallot versus dwarf. This is the differential diagnosis, the large differential diagnosis. If you did go further in the level of the three vessel view, and it was a difficult one to get, this is not the normal size of the pulmonary. So you do have to get a good visual in your brain what is the normal size of the pulmonary and what is the normal size of the, actually the pulmonary is smaller than the aorta. So to get a good diagnosis of the fallot, you should be having a good mental image of what is the normal size of the pulmonary versus the normal size of the aorta. This is an overriding aorta, but if it's an overriding aorta, hereby the aorta is a bit larger than the pulmonary, which will not be the case. So we do have an arrangement. The pulmonary is larger than the aorta, is larger than the superior vena cava. In this case, you do have a pulmonary which is slightly smaller than the aorta. So this is a fallot information. You can always say fallot versus dwarf, but the overriding aorta is slightly larger than the pulmonary. When you go further in this case, in advancing gestational age, you will notice at the end that the aorta is much larger than the pulmonary, but you do need time. So the complex congenital cardiac anomaly is evolving. It's not a rigid entity. So we do have an overriding aorta here. I will say fallot overriding aorta with VSD, tragedy fallot versus dwarf. This is our final comment. And yes, bravo. The friends are saying the three vessel view is looking normal. Who said it's looking normal? The pulmonary is smaller than, is it the normal size of the pulmonary in comparison to every case? No, it's not the normal size of the pulmonary. So we should take this in consideration, and we will change here the description of the case. Yes, let's go back to our fifth case for this week. We did have fifth case for this week. The fifth case for this week, which was also another case of hypoplastic right heart syndrome. But hereby you did see very good the three vessel view. The right side of the heart is small. The left side of the heart is apparent. So you can see also here if it's a case of hypoplastic right heart. So we do have tricuspid atresia, it's supposed. We do have pulmonary atresia, it's supposed. But where do the aorta come from? The aorta is coming. The aorta here is aligned and it's going with the. So I'm having a hypoplastic right heart syndrome. Yes, hypoplastic right heart syndrome with pulmonary atresia. You can see that this was the same case as before. No apparent, no persistent. This is wrong. I sign. Yes. So I need to revise here one comment on Facebook. We do have also the reels, my friends. Our friend Eddie Friedman is saying, I think I see the outflow of the left ventricle continuous with the ductus, so it could be transposition. Yes, it could be. Yes, it could be. Hereby we see the three vessel view apparent in a case like this. So it could be hypoplastic right heart syndrome with pulmonary atresia, but the outflow of the left ventricle, which is small, which is hypoplastic, it's go and aligned with the ductus arteriosus, so it could be associated also with TGA in this case. So thank you, our friend Eddie Friedman, for this wonderful output. And we will also go with this case and change our description here for this case. which is hypoplastic right heart syndrome and pulmonary atresia. And also we will take from our friend outflow of left ventricle continuous with ductus arteriosus. We will take this input from our friend Adi, and we outflow of left ventricle continuing with ductus arteriosus, we can say TG. This is an important one. So we did have two cases this week. One case, it was apparent hypoplastic right heart syndrome with pulmonary atresia. Our second case here, hypoplastic right heart syndrome with pulmonary atresia, and we could see the three vessel view apparent. So we can see, yes, that the outflow which is running from the remnants of the left ventricle is going towards the ductus arteriosus, so it could be associated with TGA, and this is the explanation why do you can see the I sign very apparent here. We do have the aorta only apparent in the three vessel. So let's go back to our lovely cases, and let's go to our case which is based upon it, the ultra post of this week, which is the right aortic arch. You can check out our newly ultra post with an appearance of the yes, this is deletion syndrome or the DiGeorge syndrome, which we can see and perceive in the cases of right aortic arch. You can put it in your mind that the cases of right aortic arch could be associated, the cases of right aortic arch could be associated, the cases of right aortic arch with the DiGeorge syndrome, and hereby you can see in the level of the three vessel view this right aortic arch apparent, and it's very apparent the vascular ring that it's forming. And I am responding to my friends with the yes, bravo, thank you my friend Lennon for this answer. Natalia, my friend here, yes, thank you Professor for your wonderful input. Dr. Winnie, thank you for your wonderful input. Kali, thank you. And my friend Emmanuel, always attentive as usual. Thank you, my friend. Yes, I did have a lot, actually a lot of answer. Yes, my friend here, Dr. John, yes, and Dr. Jose. Thank you, my friend. So we did have wonderful, like you can see, inputs in the case of right aortic arch. So we'll take from my friend Krishna here the answer and go and change in our blog here in your channel of YouTube. I hope you are enjoying my YouTube channel with lots of subscriptions. Thank you, my friends, and please check out our weekly ultra post. So we go to our last case for this week, which was from our friends Dr. Ala, as we seen in the post. Friday is for friends. You can send me your case like Dr. Ala. So it's a case of arthrogryposis multiplex congenita, and it's wonderful that she is depicting the legs in this wonderful manner. I can't thank here enough. Thank you, Dr. Ala from Iraq. Thank you, my friend. You can be like Dr. Ala the next Friday if you did send me a case. So I am putting all the cases that you can see from Dr. Ala, our friend, a wonderful depiction postnatal for the case of arthrogryposis multiplex congenita with clenched hand. Thank you, Dr. Ala, for this wonderful comment. And we will take here arthrogryposis multiplex congenita to change the description here. Yes, thank you, Dr. Ala. We will put here arthrogryposis multiplex congenita fetal ultrasound. Thank you, Dr. Ala. You are always brilliant. And hereby we did finish our cases for this week. I hope you did enjoy all our cases. You can see here she did put an amazing work to show us the arthrogryposis multiplex congenita, the micrognathia, the clenched hand, the flexed, hyperflexed lower limbs. Thank you, our friend, and see you next week, inshallah.